You had an issue where you and your husband had a mismatched libido,
Yes.
where his was much higher than yours. And so you've gone through sort of that experience. And what I love about you is that you weren't like, he should just deal with it. You were like, hey, I want us to have a really good relationship and it's important to me too.
Yeah.
And I'm going to work towards it. And so you did a lot of things to help support your libido. So why don't you talk a little bit about that?
Sure. Yeah. I mean, desire mismatch is, I believe, one of the most common things sex therapists see in their practice. Low libido, we know, is the most common sexual dysfunction in women. And my libido was low and it bothered me. Okay.
Right.
Like I wanted it to be, I mean, I'm very attracted to my husband, love him, like him. The sex is great. It just wasn't, the desire wasn't there. A lot of even some of the responsive desire where it's like, oh, we'll get there. You know, if we started, had diminished significantly. My husband has a very, very healthy libido, going nowhere anytime soon. Like, so, and it did contribute to some kind of marital discourse. It was occasionally the source of like arguments, if you will. I think that both sides have to be validated, right? Hey, I love you, but this desire thing is a problem. And the person's like, I feel like I'm missing, you know, this intimate life that we share. And intimacy sexual intimacy is an important part of most relationships, not all, but most relationships. And particularly for men, it tends to make them feel more connected. Believe it or not, actually, studies like men tend to be more connected with intimacy. Where for women, we want to be connected before we're intimate.
Right.
You know what I'm saying? So anyway, what did I do? You know, we talked about it openly and I was in this space. So I was like, okay, well, I might as well. I try to help people. It's funny. My husband would be like, you talk all about this libido. You haven't even, you should help yourself. And I was like, duh. I have been prescribed some of the FDA-approved options out there. There are two, flibanserin and bremelanotide. I've used them both. I also, for various reasons, have started using testosterone myself. And
which
this was
is
all
indicated off-label for low libido.
It is.
Yes.
Yep, exactly. I did this soundly and, I actually saw somebody who does this for me. I didn't do it on myself, if you will, prescribe my own testosterone. Can't do that anyway. And then an important thing that I am doing that I highlighted on my social media is, libido isn't a light switch for anybody. And these drugs and aren't going to be a light switch either. Okay. And it's really important, especially again for women in particular, like that we recognize there was lots of different things factoring into it. I mean, I was also getting shit sleep. So I started prioritizing sleep. I recognized like, gosh, when I feel generally rested, like I'm good, like more interested. We wear the doctor hat, the mommy hat, the wife hat, the, entrepreneur hat. We have all of these demands. And so I had to like be more mindful and take off all of those hats because it's very easy to be like always in entrepreneur, doctor, mommy hat when you're trying to be intimate with your spouse.
Right.
And I needed to be in the wife hat and everything else just needed to take a break.
Right.
So, mindfulness, when I like realized like, okay, I need to direct my energy and be in the moment, not multitask, not be, if I catch myself thinking about other things when I'm trying to build this intimacy, cultivate this libido, this desire, I needed to tune that in. So that was important. I read Better Sex Through Mindfulness, which is a great book. And I also saw a sex therapist.
That's great.
Like, I think sex therapy should be for everyone. Really, honestly, I think anybody who's having sex should see a sex therapist.
I think so too. Because there is no one who has a problem with sex where it's not affecting your brain.
Yes.
100%.
Yes.
100%.
Yes.
And sometimes you need a partner. Like that's what a sex therapist is, a partner to help guide you and your thoughts. Because these are the things that are causing all this anxiety and stress and whatever that's affecting your libido or whatever the issue is, right? Whether it's erectile dysfunction, premature ejaculation, difficulty with orgasm, whatever it is, it's all part of it's up here.
100%. I literally am telling every person, like, sex therapy for you. You get sex therapy. You get sex therapy.
like
you get sex therapy. My patients know. They come to me. There's two things they're going to get. Sex therapy, and if they're women, they're going to get vaginal estrogen. Okay?
Yes.
I give those out like candy. I have a list. One thing that was really important to me when I built my practice in Chicago was I went out and contacted every sex therapist within my area that I could find. I went on the website asec.org, where you find credentialed sex therapist, and I put Chicago, and I printed out that list, and I contacted every one of them and introduced myself, got to know them. They got to know me, and all of them said, "You're the first physician who has reached out."
Yeah.
And think about all the patients that we know are seeing urologists for erectile dysfunction, for premature ejaculation.
It should be,
we were never, ever thought to even think about sex therapy. Many of us don't engage with our sex therapist, but treat these things. And you have to get the patient to buy in. If you just say, here's sex therapy, I say, go to sex therapist, and you don't tell them why, they're going to think, people hear sex therapy, they think like you're delinquent, or you're not delinquent. You're
not good in bed.
You're not good in bed, or like you have a deviance, or you're sexual deviant or something like that, or a creep or weirdo. You see, I have a sex addiction. Like, no. Most commonly, these sex therapists are seeing every common everyday things that we deal with when humans have sex.
Absolutely. Yeah.
So love my sex therapist. Love the work that they do. Very critical.
So ultimately, dealing with all those things, trying these medications, trying testosterone, all those things led things to get better.
Yeah, they did.
Good.
They did. Yeah.
Good.
Yeah. And I've talked about using these things on my channel and kind of my experience. And again, it's a constant thing. It's not like, oh, do this once and then you're good. You see what I'm saying?
Yeah.
I mean, it's a constant cultivating that desire.
Yeah.
It really truly is cultivated.
Yeah. It is. I like that word. And you bring up a good point for how intimacy is different for us and different for men. And I think it's really true because, and someone said this to me and I was like, this is so true. Men don't really do intimacy outside of around the time of sex. Do you know what I mean? Like there's men, that is intimacy for them. Yeah. And someone said that to me and said, you know what? A lot of men are like that. Like they don't necessarily desire the same sort of like intimacy that we do. It's really like sex is their display of intimacy. Yeah. And I was like, that's such a true point. And so many men feel that when they're not getting their libido matched or they're getting rejected, that they're getting rejection of intimacy. And I think that's really important to bring up because they also don't know how to communicate it. And that's the problem. We've never, first of all, we've taught no one how to talk about sex, but we certainly didn't talk to men about being open with their feelings or being able to express them in the right words, right? And I think that's a challenge.
Yeah, the arguments that I referred to that I've had, when this came up is like what you're saying is he might have been feeling rejected repeatedly and frustrated and not vocalizing this. And then all of a sudden, like something completely unrelated to sex. And then it's like, the rage comes out. I'm like, where did this come from? And it's like, oh, and by the way, like you always reject me. I'm like, okay, now let's sit down and talk about this. I didn't know. Like, let's.
Right. Yeah. It's funny. We all are guilty of this. I know that men say we don't express, we expect them to know what we're thinking.
Yes.
But to some degree, there's certain times where they also want us to know what they're thinking. Yes. And I think when you're really in tune with your partner, you sort of know there's certain hints that they'll drop, like they're interested in having sex. They may not want to be like overt, but like you can tell. You get a sense. And so that's their way of trying to broach the subject. And I think you just have to be in tune to that.
Yeah. The other thing too is we're talking about like men and women and the generalization that men have a high one and women have a low one. But I've seen it the other way too. Absolutely seen it the other way. And, again, both people usually have other reasons or like other things factoring into it that need to be dealt with deeper, you know, particularly the person who has an absent or low libido, like that needs to be dealt with deeper. And I think it's important to realize like these things matter in most relationships. They can lead to dissolution or divorce or breaking up of certain relationships. There's something I saw recently, like my wife hasn't had sex with me in a year and therefore, you know, now we're getting divorced. And I think it's a shame that, not the shame in it's a year that the couple hadn't had sex, but like, okay, in that time frame, like what was done to try to salvage this?
Right.
Like what was done to try to get into why, you know, maybe that person doesn't desire sex because it hurts. And that's a whole nother thing that we have to like, that needs to be dealt with. So
yeah, I think that's the thing is, if we don't talk about it, no one's going to know. Right. And I think there's so many charged emotions behind sex. Right. And so like having those conversations is not easy. Yeah. It's not easy for me. It's not easy for you. And we talk about it all the time. Like, but in our own relationships, it might not be that easy. Right. And so you're like, okay, how do I broach this topic? How do I do it without hurting their feelings? And they may shut down or we might shut down. It's still an interpersonal thing that you have to deal with. And like, I think just realizing it's not one conversation. It's like multiple conversations over a long period of time where you might get a nugget of information. You might get some scorn. You might get some frustrations thrown in there, but like, don't take it personally. Like you're working on this and it's going to take some time and effort. And if it's valuable enough, like you're going to learn to talk about sex and ultimately you're going to have a great sex life because of it.
Correct.
You know,
on that same vein, like talking about what you like in bed or what you don't like in bed. And you can't, just because you love a person and they love you back, doesn't mean what they do to you in bed is exactly what you like or what gets you off. Like should be something that you talk about. But I think that's really hard, even for the most, you know, the couples that have been together for a very long time.
Especially if you haven't brought it up.
If you've never had it brought it up, you know? Like, hey, by the way, when you, you know, do that thing with your tongue, like it does nothing for me. You know what I'm saying? Or by the way, like you actually aren't that good at giving head. Like, let me.
Yeah.
You know, I'm like, okay, great. Like we should it should be delivered in a way that's loving, please. Right. But then also like understand that you guys are two separate individuals and take that, you know, feedback and, you know, okay, great. Now I know what you like. That and makes us better.
People will change, right? Yeah. Like our bodies are changing. Yeah. Our nerve sensations are getting reduced. So like what might have worked 5 years ago might not work anymore. Yeah. And it's not that like the person's not turned on or they're not into you. It's just that particular thing isn't working anymore. And so we just got to improvise, right? And like, I don't think it's easy to say, but like, don't take it personally. Like it is just that we're all evolving. And at the end of the day, like a lot of couples fall into ruts, right? Like we just do the same thing every time. It works. Like everyone gets off, everyone's happy, you're done. But like it gets boring. Yes. And so like, that's another hard thing to bring up is like, you know what? We've been doing the same thing every time for like,
do something else.
You know, can we just try something different? And that can be scary. Yeah. And like, you know, I think you just have to do your part and try not to take it personally if the other person doesn't respond and then bring it up again another time. In a different way, right? And just be persistent and do your part and maybe even give them a little heads up like, hey, babe, I want to talk about this in a little bit. Like, when's a good time? You know, maybe let's go for a walk. Let's talk about it, or let's get in the car and go for a drive and talk about it, or just so like they can have some mental preparation. Like, it's not a bad thing. I just want it to be better.
Yeah. Yeah. And these are the type of things that sex therapists can be really good at, like navigating as a couple. So you can see sex therapists as a couple or as an individual, and they can help navigate. I mean, I've been married for 13 years, and like occasionally we'll go out and I'll be like, okay, let's pretend we don't know each other. And, and like you try to pick me up, you know, and it's so much fun. I love playing that game. I highly recommend it. Yeah. And so then we'll like, you know, pretend like we're at the bar and we're like strangers and, you know, talk. Yeah. It's hilarious actually. But it helps. Like that, it helps to cultivate desire. So a little dating tip. Yeah.
Yeah, absolutely. And if you liked this interview with Dr. Fenwa Milhouse, make sure to check out the full episode on the Rena Malik MD podcast right here.